excellent. So this was such a wonderful presentation, and it's a really beautiful model. I don't know if you folks were reading the comments as well. Um, People were saying that this is something that should be replicated all across Canada, and there was just some really lovely comments. So you should definitely check those out afterwards. But for our first question, it was from Pamela, who's asking, what are the ages of the residents in the building, aside from the Kokums, of course?
Well, we have babies right up to, I think our oldest youth is 22. So we have babies and children, but in the youth program specifically, we have a 13-year-old, a 14-year-old, a 16-year-old, and the rest are 18 to 22.
Oh, excellent. Okay. And they're also asking, what supports do you offer foster families for First Nations children?
Foster families. We don't have any foster families per se in the building. They're welcome to come and join the community there.
Okay, great. So Jacqueline is also asking, it was mentioned that if an Indigenous or an additional building was built, that you would do things differently in the design. So would you be able to share what these differences, changes, or add-ons would be? And would you also mention, they're saying that they would also like to mention how much they enjoyed the session, and they fully agree that this should be replicated across Canada.
Oh, well, thank you very much. And I think it should be too, because I think families deserve to be together with supports. It costs a whole lot less for government and everyone, and takes the pressure off of the systems that are already overtaxed. But what I do differently about the building is I'd absolutely have, if you've ever been to our first build, Ambrose Place, we have an incredible ceremony room when you first enter the building. And it just welcomes you because the medicines are burning and people are in there praying or having sessions. And it just sets the tone when you walk into a building. And I would replicate that. I would also have what I call drop walls, where if a family was in crisis and the parents had to be removed in order to keep the kids in care, we would drop a wall and a cookum could be attached to the family. And then when they're doing good, the wall goes back up again. And that allows the cookum to keep her autonomy. She does have her home, but when a family's in crisis, the wall can be dropped and she'll be right in with the family. Those are some of the big things I change.
Pearl is cutting a little bit, but hopefully.
There's also one thing I would like to see too in a different setting too, is just a space to be able to have like fire ceremony, right? Like just having a nice open courtyard somewhere, to be able to have that fire there going whenever we needed it.
Yeah, she brings a good point. We need green space attached to the building. We have no green space at all. We're just on a tarmac and little tiny plots of grass out in front of the townhomes. So the building is comprised of 6 separate townhomes, and the rest are all in apartment style building in the building.
So Dawn is also asking if there's a cost to the youth and the others who stay there.
Well, many of our clients are referred through Home Trust's by names list. Mm-hmm. And so some of them will come attached with some funding, but our housing support workers' job is to find them other forms of income. So if they're eligible for aid or income support, then we'll do that. Or after perhaps a year of funding through Home Trust, we may have them ready to join the workforce or go back to school or whatever it is they've decided to pursue.
Yeah, we have one youth that actually transitioned and she's working full time too. So she's able to manage her rent and the expenses there. So
Right. And we've had 2 youth at school,
mhm.
which is great.
And actually, some folks, we have Alex Nelson, who's also asking. They're saying thank you for sharing the incredible project. And I'm wondering if you could share some perspectives about connecting these practices with youth currently in care.
Yeah, of course, we would love to. We only have so many people, and we have to find funding to do that kind of work, but it's absolutely the best way to bridge that gap. And so I am in discussions with children's social services to look at ways of bringing kinship care and wraparound supports if the parents have to leave the home because they're off track. The whole concept is to keep the family together, because when parents know that their children are still being housed in the same place and they're not lost to the system, they are motivated to change and come back to reunite with their families. And then if we were able to reach out and start building relationships with kids in care that are getting ready to age out, it allows that transformation to go much more smoothly. So that's a really good point. You could tell me where to find funds to do that. I'll gladly apply.
I'll just jump in. I think that's part of our job also as a research team, is to document and share this information in conferences like this and across the country to start those conversations of you know, how you know, this is once kids are out of care, but when preventing children from being in care and keeping that connection with their community. And so that's our goal as researchers, is to foster those conversations as well. I mean, Carilla and Arlene obviously do a great job, but we can help also disseminate that information.
Absolutely. And I think you had put in the address for the project, correct? The web address?
For Niganon Housing Ventures, and a couple articles that were written about the project, and hopefully we'll have more coming as we collect more data.
Oh, great. Well, so if anyone needs some information for now, you can check out the website in the chat. We have a lot more questions actually coming in. So have you been able to quantify the annual savings? Usually there is a time lag for cost savings.
Yeah, we're just so new. We haven't been able to do that, but that definitely will be something we are following. I can give you an example of when we opened Ambrose Place. So that's sort of a level 4 care for houseless people. And so these are chronic homeless people that we did a research Grant McEwen and the U of A on that. And we showed the savings all the way around with the justice, court system, the criminal justice system, EMS, hospital beds, alcohol and drug use, treatment beds, and the cost savings through the 2 years was close to 2.8 million, I believe. So I mean, you add that up, we've been open now for 6 years. We're saving a lot of taxpayer dollars, and we're saving lives, because a lot of these people are living much longer than they would if they were on this. So no to the question you asked, not yet for Omamoo Wangugumik, but I'm sure there will be a cost savings attached for sure. Because these kids are not going into care. They've had five sessions or 5 units where the child welfare system has has said, okay, we're stepping out, and these parents are doing fine. And they trust that if we need to bring them back in, we will as an organization if we can't solve the issue.
So we have one more question here from Kim, who is asking, do you do suite inspections for all in the building? And if so, how often? What did that look like during COVID? And is there a limit to how many people can live there?
Do you want to answer that, Arlene?
Sure. So we had designed a sort of like a, I guess, sort of like a case management tool for our youth worker to be able to, check on the youth on regular intervals. So on a weekly basis, she'd go to the different suites and just checking on how they're doing, what their needs are. But there's also a lot of staff there that kind of help and assist. It's usually, every couple of days we give them a notice that, hey, we're going to come check on you. But there was always constant conversation and texting, reminding them, if there's things happening up in the main area, like on the 5th floor, we have sort of like a gathering space. And so they would come up there themselves, like when they knew something was happening. And so we were able to check on that. And because this apartment, it's independent living, right? So we have to follow the landlord and tenancy rules and regulations, so all of that comes into play as well too. And we just explain, why and why we're doing inspections and what we need to do. And yeah, so what was the other part of that question? I know there was a first.
Sorry. It was, if you do the suite inspections, how often, and just what that looks like during COVID, and how many people can live in the units.
Okay. So yeah, again, I think that depends on the size of the units. Right now we have the bachelor suite, and we have a 1-bedroom, and we have 2-bedroom sort of like townhouses. They're all attached, right? So it just depends. We have to follow those guidelines that are set already. So we do our best, right? And if the units are no longer suiting their needs, we'll also help them try to find other housing within the city through our different partners.
Yeah, and so that's another thing, change in another building is make more than 2-bedroom places. Like if you look at our townhomes, they have 2 bedrooms, and that gives the mom and dad space, but then you can have 2 children, or you could have 4 children if they're all under 4 mile, but only 2 children if they're of the same sex. So the next build has to accommodate families of 5 and 6.
Mm-hmm.
And I have one more question for you folks, because there are so many messages about how this needs to be scaled, how this is such a beautiful model. So do you have any ideas or advice for how we can scale this project, or how we can help you folks scale it?
What does that mean, scale? What do you saying?
Expand the project, I guess, to
Do more.
do more of this. Yeah.
Well, we're all about sharing with our brothers and sisters across Turtle Island. So, and you need information and you want to do something, we'll share our information to help you, or we'll partner with you and help you build it. I think just to me, it's really common sense, and just going back to the way we always lived in communities. It's not really new thinking for me. It's old thinking, bringing it back. And I think this goes for others, not just our own Indigenous people. We need to bring community back into everything we do. And the only way you do that is reach out and build relationships with one another.
it's also being flexible with your budgets, right? Being flexible with your funding and the way you're applying for dollars, and you know, having that understanding of how communities and societies lived together before, you know, is really helpful. So having, in this case, like, you know, Indigenous families, understanding ceremony, understanding what that funding should look like, you know, and what it should support, um, would help a lot, right? It's what we know how to do. It's a part of our lifestyle. So for us, it seems easy, but also understanding, you know, that a lot of this was lost. And so we're just revitalizing it, rejuvenating it, reminding people that they're, you know, we have inherent rights to practices and stuff. So just kind of looking at your budgets, and you know, we're so grateful at Omamoo and Gogamic that we have a leader like Corolla that understands that. And so trying to write a, you know, 2-3 page brief on, you know, why we need this funding or why we need to have something. It's, you know, we don't have to do those sort of things.
And I would say funders need to be flexible, because I know there were a couple of times we've worked with Corolla on different funding applications, and then things come back, oh, this doesn't fit the model of what we're looking for, and it's because the model is also a very colonial way of doing housing. And so I think anyone who wants to fund something like this needs to understand that just give Curl money first of all, and she'll just do it. Or just, you know, let, as I have learned, the Indigenous organizations take the lead, because they know what they're doing, and we need to just step back and facilitate and help foster those relationships. But they're the ones that know what they're doing. I have to say, you know, I've been working with this for a couple of years. And when I met Corolla, I know it was a dream she's had for a very long time, but it was still a dream. And 2 years later, it's a reality, all because of the hard work she has done. And I just want everybody to know that she's being honored for her hard work at McEwen, and we're giving her an honorary doctorate because of the amazing work that she's done. So we're very excited about that. So I don't know if I think it's public. It's happening in a couple of weeks. So I'm saying that.
You heard it here first.
we need to celebrate the work that Corolla and others like her have done, and listen to them. So
Absolutely. That's so well deserved and a wonderful way to end this conversation. Thank you folks so much. And I think there are some more comments and questions coming in, but we were supposed to finish our call a couple of minutes ago. So just so you folks know, Corolla, Cynthia, you can, and Arlene, you can always go back into that platform and respond to people if you'd like, and just read the nice comments. And thank you again. That was such a wonderful presentation. So
thank you so much.
Hey.
Yes, something.
And thanks to all the attendees too for the lively discussion, of course. Take care.
Thanks.